Okay, go.
Chest pain again?
Yeah, same one.
Okay, ready?
Yep.
You are being dispatched to an 80-year-old female complaining of chest pain.
All right, BSI, is my scene safe?
Yep.
It is.
My number of patients?
1.
All right, I'll call for ALS backup. And my general impression is that I have an 80-year-old female sitting in her recliner in her living room complaining of chest pain. Is my patient, do I need to consider C-spine?
No.
Okay, is my patient conscious?
Yes.
Okay, so then I'm going to introduce myself. Hi, my name's Angela. I'm from the ambulance service. How are you today?
Not too good. My chest is hurting.
Your chest is hurting? Okay, so I can tell, I'm checking my patient's ABCs right away, so I can tell her airway is patent because she's talking to me. I can see that her breathing is fine, also because she's talking to me, and I can tell by her respiratory rate that it's normal. And her circulation is, she looks pink, warm, and dry, so I think that her circulation is adequate for right now, so I'm gonna determine this as stay and play. So you're complaining of chest pain, so I'm gonna ask you a few questions. Is it okay if my partner gets a set of vitals from you?
Yep.
Alrighty, so you're complaining of chest pain. When did this start?
About an hour ago.
Alrighty, and do you have any history of chest pain or any medical history at all I should know about?
Nothing significant. I was prescribed nitro for recent chest pain that started about a month ago.
Okay, so you're taking nitro. Do you take any other medications?
No.
Do you have any allergies at all to medications or anything?
Yep, I'm allergic to aspirin.
To aspirin? Okay, do you have any other or allergies or just aspirin?
No, nothing medical.
Okay, when's the last time you had something to eat today?
I had about 30 minutes ago, I had a piece of toast and some water that I also took with my nitro.
Okay, so you took a dose of nitro, and did that nitro seem to help at all?
No.
Okay, so you ate some toast and water right before you took your nitro about 30 minutes ago, but the nitro hasn't seemed to help.
Mm-hmm.
Okay, what are my vital signs come back as?
Its blood pressure is 100/91. Respirations are 15 a minute. Pulse is 72. SpO2 is 94.
Okay, so ma'am, are you okay if I put you on some oxygen here? Your oxygen levels are a little bit low right now, and I'm gonna ask you some more questions.
Okay.
Okay, so I'm gonna give my oxygen, I'm gonna put her on oxygen and non-rebreather at 15 liters per minute. I'm not gonna give her nitro quite yet because her systolic is just at 100. So I'm gonna load her into the ambulance and keep her on the oxygen. I'm gonna ask her some more questions, so, and have my partner take another set of vital signs after a few minutes on oxygen. After a few minutes on oxygen, what are my vital signs?
Her blood pressure is up to 120/88, and SpO2 is up to 98.
Okay, so at this time, because her blood pressure is up a little bit, I'm going to administer her nitroglycerin that she has a prescription for. It's in date, it is not expired. I have verified that it's not expired, it's the right patient, it's the right dose. So ma'am, I'm going to help you with administering your nitroglycerin with just a spray underneath your tongue. Alrighty, is your pain radiating anywhere?
To my shoulders.
And how would you rate your pain?
It was at about almost a 7.
A 7 out of 10. All right, well, hopefully this nitro will help a little bit. Does anything that you do make your pain worse or better?
When I'm just laying down, sometimes it helps.
It makes it feel better if you're just laying down versus like sitting up?
Yeah.
Okay. And what were you doing when this pain suddenly came on?
I was just laying in bed watching some TV, eating my toast.
Okay, so you weren't doing anything strenuous or anything like that, you were just laying there?
Mm-hmm.
Okay, and how is your pain feeling now? You said it was a 7 out of 10 originally. Now that we've given you the nitro, does
Yep.
it feel any better?
It does. It's alleviated. It's about a 5 out of 10 probably.
About a 5 out of 10 now? Okay. So we're gonna keep you on the oxygen. We're gonna transport you to the hospital. We're gonna continue to monitor her blood pressure to make sure that systolic is staying above 100. We are going to, then once I get to the hospital, I'm going to give the nurse a report. In my report, I'm going to include the patient's chief complaint. So I have an 80-year-old female who presented with chest pain. She was just lying in bed when the chest pain came on. She is prescribed nitroglycerin. She doesn't take any other medications. She did take her nitroglycerin 30 minutes prior to our arrival. It did not help alleviate the pain at all. Her last oral intake was toast and water, which was also 30 minutes prior to our arrival. Like I said, she was just laying in bed when it came on. Her only allergy is to aspirin. So her original vitals were 100/91 for blood pressure, 72 for pulse, and 94 for SpO2. So we put her on a non-rebreather at 15 liters per minute for oxygen. I talked with her, got some history from her, and then we reassessed her vitals. At that time, her blood pressure was 120/88, so we felt comfortable giving a dose of her nitro. I gave her a dose of nitro. She originally rated her pain at a 6 out of 10 after the nitro, and her most recent rate is 5 out of 10. She says that laying down sometimes makes it feel better, but nothing else besides laying down, apart from laying down, makes it feel any better or worse. She doesn't feel like it radiates anywhere. The time that it started was approximately an hour prior to our arrival. My idea of what's going on is that she has unstable angina going on, and we treated her with the oxygen and the 1 dose of nitroglycerin, and her most recent vital signs were 122/78. And that's it.